Codetree Initiative.
Welcome to this new episode. Today, we're taking a step back to introduce the podcast itself, what it's about, why it exists, and how we approach the complex world of healthcare.
Yeah, that's right. We want to start by explaining the mission behind this podcast. Healthcare affects all of us, but it's often complicated, confusing, and honestly, pretty opaque. Our goal is to cut through that complexity and provide clear, thoughtful discussion.
Exactly. And we're not just here to talk about healthcare in broad strokes. We want to dig into the real issues, billing headaches, insurance puzzles, patient rights, system failures, and also share stories that show both the struggles and the resilience people experience.
It's important to say this episode is foundational. It sets the lens through which we'll examine healthcare topics in future episodes. We want listeners to understand not just what we cover, but how and why we cover it.
Speaking of how, let's talk about us as hosts. We're longtime friends, and that dynamic really shapes the tone here. We aim for a warm, conversational style that's professional but approachable. We want to make complex healthcare topics accessible without oversimplifying.
Right. And just to be clear, we're not healthcare professionals ourselves, but we've spent years teaching and podcasting, so we know how to break down complicated ideas. We want to create a space where thoughtful discussion can happen, where listeners feel like they're part of a conversation, not just being lectured to.
That's a good point, and the podcast mission goes beyond just explaining things. We see it as an advocacy platform. Healthcare is a system with real emotional and practical challenges, and we want to empower listeners with knowledge and understanding to navigate it better and to push for change where it's needed.
When you say emotional and practical challenges, can you say a bit more about that?
Sure. Healthcare isn't just about policies or procedures. It's about people dealing with stress, uncertainty, sometimes even fear. And on the practical side, things like confusing bills or insurance denials can add a huge burden. We want to acknowledge that and help people feel less alone in it.
That makes sense. So, what kind of topics will we cover?
The scope is broad but focused on what really matters. For example, billing and insurance challenges are often the most frustrating parts of healthcare for patients and even professionals. We'll unpack those.
And patient rights are another big area. Knowing what you're entitled to, how to advocate for yourself, that's crucial. We'll also explore medical system failures, looking at where and why the system breaks down.
Plus, we'll share stories from real people. Stories of struggle, but also resilience. These aren't just anecdotes. They're opportunities to learn, to raise awareness, and ultimately to inspire change.
That broad scope means the podcast is relevant to a wide audience. Experts will find nuanced discussions and real-world implications, while non-experts can gain clarity and practical guidance.
Speaking of format, each episode will combine careful breakdowns of complex issues, explaining jargon, policies, and processes clearly, with expert perspectives when relevant. We want to deepen understanding without overwhelming.
And we'll always aim to provide actionable guidance. Listeners should come away with practical steps or resources to help them navigate healthcare challenges.
The community stories we share are key. They illustrate systemic issues and resilience in a way that statistics or policy papers can't. These stories help bridge the gap between policy and lived experience.
And the tone throughout is empathetic and supportive. We know healthcare navigation can feel overwhelming and isolating. We want listeners to feel heard and supported here.
That leads us to community engagement. We invite listeners to share their own stories, questions, and concerns. This engagement is crucial because it helps surface systemic problems that might otherwise stay hidden.
Right. And by amplifying patient voices, the podcast contributes to awareness and systemic change. It's not just about information. It's about creating a space where people feel connected and empowered.
Now, why does this podcast matter to experts? Even professionals face challenges in healthcare due to its complexity and opacity. We act as a translator and navigator, helping experts see the human side of policies and systems.
That's important. The combination of expert insight and real stories provides a richer, more holistic understanding. It reminds experts that systemic change is essential, not just individual practice improvements.
To help explain our role, we use some mental models. Think of healthcare as a dense, tangled forest. We're the guide helping listeners navigate confusing paths.
Or the podcast as a translator, converting complex healthcare jargon and policies into clear, actionable knowledge.
And the stories we share are like live case studies, revealing systemic strengths and weaknesses.
Finally, advocacy is like a spotlight, shining light on hidden problems to drive awareness and reform.
So, to wrap up, this podcast is more than just information. It's a community and a movement toward better healthcare understanding and systems.
We balance technical depth with accessibility, making it valuable for experts and non-experts alike.
Our warm, professional tone invites listeners to join a conversation that's both informative and empowering.
Future episodes will dive into specific healthcare issues, but this foundational understanding of our mission and approach is key.
Think of this podcast as a trusted companion in the complex world of healthcare, helping you make sense of it all.
Thanks for listening. We look forward to exploring these important topics with you.
And remember, your voice matters here. Share your experiences and questions. We're all in this together.